Hi, I'm Dr. Sabrina Shah-Desai, an aesthetic oculoplastic surgeon based on Harley Street in London. And I'd like to talk to you about baggy lower eyelids and eye bag surgery, one of the commoner procedures I perform here in my London practice. Now, eye bag surgery can be quite challenging, and this is primarily because the lower eyelid is a continuum of the cheek. And as we age, round about the age of 35, we're losing bone in the anterior cheek, and as the bone resorbs, and of course it doesn't resorb as quickly as we think. It's a very slow process from your mid-30s to your mid-70s. There is a loss of support and the cheek fat pad shifts downwards. We also have an expansion of the eye socket, and this eye socket expansion along the loss of the mid-cheek bone causes a domino effect where the fat pads that are being held in place by these bony structures of the face are lost, and therefore one of the early changes when you get an eye bag is primarily a bag prolapse because of this downward shift and inward shift of this anatomy. So this domino effect occurs and the fat pads of the face indeed appear to be descending or shifting downwards, and this impacts the under eye area, where you get a little collapse of the fat pads, and then the internal eye socket fat pad just begins to prolapse. Now, when the fat bag is very mild, patients do really well with fillers because it gives back some of the midfacial support and the under eye soft tissue volume that has been lost. However, when the fat bags are progressively prolapsed and they're quite large, then in this position, it's almost like a hernia of the fat under the eye, then eye surgery is actually the preferred option. So the older you get, think about close to your 50s, you want to move away from just having a lot of filler and consider having eye bag surgery. One of the commoner surgical procedures I perform in eye bag surgery is a scarless lower lid eye bag procedure called a transconjunctival blepharoplasty, where the cut is made from the inside of the eyelid. There's no visible cut on the outside of the eyelid, and that little bit of fat that has become visible is either removed or repositioned over the bony rim. So when we reposition fat, we can only reposition it with the amount of fat you have. And if you don't have adequate fat, then obviously the results of surgery are not going to be a really smooth result, but they will be better than what they were before. And often we need to augment the result of surgery with either fat transfer or by using dermal fillers a few months after surgery. Now, when you have a lot of loose skin, then I use a cut on the skin, and this is called a transcutaneous approach, and this is a preferred approach if you have a lot of loose skin. So you can see that there are these two different approaches, where if you have loose skin, then it's better to put the cut on the outside, and this affects the downtime, but the eyelid is tightened simultaneously along with repositioning or removing this hypertrophic fat bag. Often I would combine treatments so that we're still trying to avoid a scar on the eyelid and doing the procedure from the inside, but then we treat mild loose skin with some energy-based treatments for which we have Tixil or laser or Morpheus 8, a plethora of energy-based treatments that can be used to improve the loose skin on the surface. Surgically, I would need to do a tiny little skin pinch along with a canthopexy, which is to tighten the outer corner of the eye. So these energy-based devices are similar to CO2 laser in terms of the skin tightening, but the advantages are that you don't actually have a scar and the downtime is minimal compared to CO2 laser when I use Tixil. So this is sort of a recap of everything that's involved in lower lid blepharoplasty. Downtime is approximately 2 to 3 weeks, whether it's an outside approach or an inside approach along with the laser resurfacing. You are swollen for a couple of weeks, so this requires a fair amount of time off from work for a couple of weeks, and it can take up to 12 weeks for our outside approach eyelid to heal fully. The procedure is done under a general anesthetic, but it's as a day case. So you come into the hospital and you go back home the same evening. And most people, of course, can go back to work a few weeks after the surgical procedure. I hope this little video has answered most of your concerns about eyelid surgery. However, if you do have more questions, please don't hesitate to contact my team at Perfect Eyes Limited or visit my website. I look forward to seeing you.